This week on the BackTable podcast.
I did a lot of Peloton during the pandemic, and there's a phrase that they use in Peloton that I love, which is, I make recommendations, you make decisions. And I use that with patients a lot. And a lot of times, even the person who's like, no, I'm not taking that insulin, or I don't want to get induced at 39 weeks. I want to keep going. When I explain the rationale that I have, and then I say, but that's my recommendation. At the end of the day, I'm going to support you in the decision that you make. Once it's in their hands, once they know that they have the power, people make the right decisions for themselves, right? Like we are actually well-made and we are perfectly competent of making good decisions.
Hello, everybody. My name is Veronica Lerner. I'm a MIG surgeon and a guest co-host for BackTable OBGYN. I have an honor privilege of hosting Dr. Ebony Carter, who is an associate editor for Diversity, Equity, and Inclusion at the Green Journal, our beloved way to connect, and also my mentor and a friend. And I'm going to pass this on to her to introduce herself and talk a little bit about her role and how she got here.
Veronica, thanks so much for having me. My name is Ebony Carter. I am a high-risk obstetrician, and my current day job is the division director for Maternal-Fetal Medicine at the University of North Carolina at Chapel Hill. And also, very excited to be an associate editor for equity at the Green Journal, which is the journal at the American College of OBGYN.
Well, this is a very short introduction, but there's so much more in those few sentences. I first met Ebony when I was still serving as an editorial board member on the Green Journal, and I was just completely blown away by her accomplishments. And as I got to know her as a friend, then she just became my hero forever. So I just wanted to rewind a little bit, and maybe Ebony can tell us a little bit about kind of your career in OBGYN, how you got interested in research, and then specifically what led you to the equity path.
Sure. So I think that my career in reproductive health equity started very early because my mom was the executive director of the Ohio Commission on Minority Health, and she was my shero. So I spent much of my childhood riding through the highways and byways of Ohio as she did community organizing. And, I often tell the story of the way that she would open her speeches. And she would start off by saying, in the shadows of our finest medical facilities, where kings, queens, and shaws travel from around the world for the best medical care in the world, Black babies and mothers continue to die. And, that was the early 1980s. And, it's ironic that here we are 40 years later. I'm delivering babies in those same hospitals that my mom was speaking about. And her words ring just as true today as they did then. So I think that my life's work is to pick up where hers left off. In the 80s, people didn't even really talk about health disparities or realize that there was one. So she kept making the case that this is a real problem. In this day and age, we all know that it's an issue. And the question is, what are we going to do about it? And so that's really been my life's work. When I'm thinking about what prospective project I'm going to do next, or whether to say yes, because I have a problem, I hate telling people no. I always ask the question, will answering this question improve health outcomes for those among us who have the worst outcomes? And if the answer to that question is yes, then most likely my answer is going to be too.
I just had to pause for a minute and think about your mom, Yoshiro, is how visionary she was at the time to call out this problem, which literally took us decades. Like we just literally put labels on words and labeled it just the way we can communicate with each other, right? Like I just remember starting out as a peer reviewer 15, 20 years ago, and I would notice an equity issue in an article that I was reviewing, and it would take me literally 2 or 3 paragraphs just to explain myself and what I was referring to. And I know by the time I've gotten to the actual need of things, like I either lost the audience or the audience thought I was lost. So I think we now have the tools to really convey what it is we want to say, especially in academia, but it's just really amazing that so far out, she was able to capture the essence of what we're really are struggling with right now.
And what's really funny is every April when we get to Minority Health Month, my mom started doing Minority Health Month in the state of Ohio in the 80s. I mean, I think it might have been like the first or one of the earliest Minority Health Month kickoffs and celebrations. And so I remember as a kid going to downtown Columbus to the state office building where she worked, and they would have drumming and music and food, and it was a huge celebration. And they funded grants across the state, like small community organizations, because she said then the same thing that I say now. that the solutions to what's happening in a community are going to come from that community. And so they funded innovative, interesting grants for people to try out solutions in their own communities in the 80s. And so every time, I see Minority Health Month or anything else, I can't help but like smile and think like, I think my mommy might have been the first.
It's so interesting too. And if I think back, like people would ask, like, what does a mixed surgeon and MFM specialist have in common? Well, it's the fact that we're looking at community engagement at this point, right? Like we know it's mountains beyond mountains when we're talking about systems and health systems or even our institutions. But if we think about community engagement, maybe that is one of the venues which is in our sphere of influence, right? Like our sphere of knowledge is all the things we know, the systems, the mountains, all of those things. But maybe our sphere of influence is actually what's next to us. And one thing that comes to mind is actually endometriosis patient advocacy movement. Now we have Nancy's Knock, where patients can basically vet out their own surgeons and find out who does real excision surgery. There is Below the Belt documentary that Hillary Clinton funded, right? Like there is just such a massive patient advocacy movement that was basically initiated by one nurse and then picked up by the patients, right? And the surgeons finally engage with the community. And that's a real thing when patients are coming to their appointments prepared with questions. And actually, I would say, I don't know, maybe you can comment more a little bit about on what it feels like to you in your day-to-day practice. In my practice, when patients come to me and they say, I've been in pain for 2 years, the articles say that it takes 10 years to diagnose endometriosis. I'm the statistic. I'm fighting the system. Are you here on my side or you're part of the system? Like, which side are you on? And for me to acknowledge and just say that, yes, I'm part of the problem, but I'm trying to fix things and come up with solutions and correct the wrong in my little sphere of influence is huge, because then all of a sudden we're on the same page. Like we are actually a team and they don't see me as the other and you don't see me as somebody who can actually hurt them, right? It's not like a patient-doctor relationship. It's really more of a partnership. So I was just curious, if we are kind of seeing that in the obstetrical realm, or how do you see that play out in terms of sort of that patient-doctor collaborative and then the extension into the community in a way?
Yeah. So, I think that there is a richness in listening. Like people just want to know at the end of the day that they were heard. And so when I am counseling, I love using shared decision making in terms of what's going to happen. And oftentimes I have a recommendation like, this is the background. And based on this information, this would be my recommendation. And then sometimes I saw a patient doing antepartum rounds yesterday. And it was gray. She could have gone either way. And I gave her both options. And I said, the right one is whatever is right for your family, because when we know the evidence, I'm going to make a recommendation. If we don't, you get to make the hard decisions. And so I think that even if a person is really hesitant, or I've just given bad news that they didn't want to hear, that they are a little bit skeptical of, I I did a lot of Peloton during the pandemic. And there's a phrase that they use in Peloton that I love, which is, I make recommendations, you make decisions. And I use that with patients a lot. And a lot of times, even the person who's like, no, I'm not taking that insulin, or, I don't want to get induced at 39 weeks. I want to keep going. When I explain the rationale that I have, and then I say, but that's my recommendation. At the end of the day, I'm going to support you in the decision that you make. Once it's in their hands, once they know that they have the power, people make the right decisions for themselves, right? Like we are actually well made and we are perfectly competent of making good decisions. I think if they're well supported and educated. So I think that goes a long way in the patient-doctor relationship. And in the same way, in terms of community partnerships, the largest grant that I have right now is actually a community academic partnership that started back when I was at Washington University in St. Louis. And as you were talking, I thought about the fact that about a year or so before this collaborative came together, I had an idea for a randomized trial that I wanted to do. I wanted to look at group prenatal care and the role of mental health and maybe embedding some mental health interventions into group prenatal care. I partnered with a psychologist. We hired a research assistant together, and I'm going to do this little randomized trial. And then 6 to 12 months later, I get a phone call from a OBGYN who also happened to be the chief medical officer at the largest community health center in St. Louis, saying that she wanted to pull together all of the people who did group prenatal care in St. Louis to figure out how to change outcomes. And it's interesting because when that collaborative came together, led by patients, actually, they had a very similar thought to, the one I had, like, let's look at like mental health and how do you embed behavioral health intervention in group prenatal care. Now, the thing is, if I had done that randomized trial, it would have been done long ago, right? It would have been neat. It would have followed, all of the good scientific methods. I would have got my answer and we would have been done. And it probably would have been a heck of a lot easier than the journey that I went on. But the journey that I've gone on with the people in the Elevate Collaborative, which is a transdisciplinary group of patients turned partners, OBs, midwives, nurses, community-based organizations. I mean, it is representative of the richness of the city of St. Louis and is now spread across the entire state of Missouri. And we have gone through ups and downs, and we have fought. We have been broke. We've been unable to make payroll. We've gotten $4 million grants. We have gone through so much together. And because of the process, because we listened to community partners, and when patients said this is important, I mean, the patients literally had and have the most important voice at the table. What we've created, what has come out of that is so much better than anything that I could have conceptualized in a randomized trial that would have come and gone in 3 to 5 years, been published, I would have gone on to the next thing. I think that this work endures because at the end of the day, our community partners know so much better than we do.
That's so amazing. I want to go back to that in just a second and reroute that into the rubric that you spearheaded after you became an associate editor for Diversity, Equity, and Inclusion at The Green. But can you give a couple of examples of what your collaborative came up with that you don't think you would have even thought of if it was just you working on this project?
Sure. So, I mean, one was we looked at group prenatal care and the way that it was being done. And our patients, kind of had some issues with some of the things that were happening there. And so the fact that we basically started all over again, took a year and designed an entire curriculum that was essentially created by and for Black birthing people. I wouldn't have thought to do that, right? I would have taken what was already there and kept it moving versus starting from scratch, which is essentially what they did. And even though it was created by and for Black patients, it has been adapted to multiple populations. Actually, about 25-30% of our Elevate groups are Spanish speaking, and it has been adopted to that community in a way that serves them well. And, the other thing is when in the early days, we were trying to figure out how do we embed this behavioral health intervention in group care? And part of it was because there was a shortage. There were no social workers, there were no psychologists or psychiatrists. Like if you were poor and pregnant and had a mental health need, you were out of luck. And so part of the idea was to create that capacity to make OBs and midwives and family practice docs mental health extenders, and then, make it so that they could deal with maybe 80% of the mental health issues in the group. And then we could have that robust referral network for anything that couldn't be addressed in a group space. And so I think another pivotal moment that I often share, I think because it was impactful to me, is we were talking about trauma. And the majority of our patients had experienced some type of trauma in their life. And so we were having a debate, should we ask patients about their trauma? And most of the medical professionals in the room were leaning towards no, because once you open that can of worms, what are you going to do about it? It's actually unethical if you ask and then you don't have any resources to then help and support. And so we were kind of leaning towards, we're going to leave that one alone. And one of our patients turned partners listened to the debate for 15, 20 minutes and then said, that's the problem. You don't ask us about trauma. You just act like it didn't happen. And that therein lies the problem. You have to ask us. And we were like, changed the entire direction of the conversation, changed how we approached it. And I think that is the power of having patient voices at the table. And one other example I will give you is we had a community advisory board for the OBGYN department. And I ran a small internal grants mechanism. It was called the Lab Award, the Lucia, Narca, and Betsy Award, with the idea that you cannot get research funding in this department and not know that history. And the fact that none of us are immune to ethical dilemmas, right? We could have our own Tuskegee or modern day Lucia, Narca, and Betsy in our midst that we are doing wrong by. So none of us are immune and we're all held to a high standard. And you have to know that to get the money. So anyway, part of this in terms of the learning was to have senior investigators in our department who were on our study section. We ran it just like an NIH study section. The first time I was on an NIH study section, I was like, whoa, I wish I had seen this like five years earlier, because you're a much better grant writer when you've had the experience of critically reviewing somebody else's work. So I wanted our trainees and our early career faculty to have that experience. So we have our study section and we included a patient on the study section. And I remember that there was a grant, and I don't think the person who submitted this will mind me saying it, but the grant was essentially looking at forceps placement because our residents were not being adequately trained in forceps and they weren't getting enough experience. And, half of the battle in forceps is just placing the blades. Like if you can place the blades, like that's actually the hard part. And so she had an idea that she would take patients who had an epidural, so they had, good anesthesia, and then they had had more than one baby before, and ask their permission to place the blades, have an attending physician check it, and then they could count that as forceps, and we would have better trained physicians in forceps placement. So that was the idea. All of us as OBGYNs thought this was brilliant, like great, like this is an important critical skill. We are losing it in the field, and this is a great way, if patients give permission, to make sure that our trainees get this experience. So we read the grant. All of the OBGYNs in the room were like, yeah, that's a great idea. And the patient who was sitting in the room was like, this is ridiculous. Like, I can't believe what you all would even think to ask her perspective was very different than all of our perspective. And I think that's why you need that representation. It made us approach and think about that application in a very different way, from a voice that otherwise would have never had representation at the table. And I think therein lies the power of patients and listening to them and what they have to say.
Those are just such incredible examples. I love those so much. Of course, I have to put a plug in because I did a forceps simulation last week. And we spent 2 hours putting the forceps, start taking them off, put them on, taking them off. And I already did it 10 times until I felt comfortable. Anyway, obviously not the same thing. There is the simulation in real life. But those are just such incredible examples because I think we all get blindsided, and to acknowledge our own bias, no matter where we are, is just so important. And this is just a perfect example of it. You need to understand somebody's perspective. It's perspective taking, right? Like last time I was getting on a plane, I saw a female pilot. I was like, female pilot. But I was like, wait a minute, I got to take my bias. Like I know female surgeons and doctors are actually deliver safer care. And that's probably true for the pilots. I have no idea, right? But it's interesting how internalized misogyny and all the other isms are internalized by us in some ways too. So it's not just our own biases that are playing out that we have to keep in check. It's also we internalize all of those inequalities that are done to us too, which is even more striking. But
well, I think the nice example for physicians that I often use is that I think people feel personally attacked. Like, I'm not racist. And I think in this day and age, especially, there's a sensitivity around that. And I always use the example as physicians, bias actually in some ways serves us extremely well. So when there is a postpartum hemorrhage where a patient is trying to bleed out to death and I get called into a room to handle it, I run in and I spring into action. I'm not thinking about books. I'm not thinking about, page 122 of Williams. I am running in there and I'm using all of the biases that I've accumulated over my years of clinical experience, what I've done that worked, what didn't work, what I know from the evidence. And I'm not thinking about these things, right? It's just like that kind of meshed stuff in my head springs into action through the tips of my fingers, and I run and I take care of that patient. And bias in that situation is helpful because she'd be dead if I went through the mental gymnastics that were necessary to recall every single thing I had ever learned or did. And I think we can all inherently realize that. And in the same way that bias can serve us well and can actually really help us in our clinical management, it can also cause harm. And that doesn't mean that I'm a bad person. It doesn't mean that I woke up this morning deciding to be racist. But if I'm not actively aware of that, then I can cause harm. And I think that when people are so prideful that they can't acknowledge that we all have it, there's an example that I have used before. My husband told me, stop telling people that example. But it's true. It's a time that I went to work and my bias showed up where I did something for a patient that I would never normally do. But she reminded me of my family, right? Like the accent that she had, it was the same accent as my aunt. She had gone to high school with my cousin. When I looked at her, I related to her like she was like family. And we were out in the middle of nowhere in this rural clinic waiting for help, right? Like she has these severe range blood pressures. And so I'm talking to her while I am trying to call in help, but I'm in the middle of nowhere and help is not coming. And the way that I cared for her is not anything I would ever do, except in that time, I felt connected to her culturally in a way that I normally don't connect with patients. And that also is a form of bias. So yeah, I think part of it is just checking at the door, kind of like pride and, I'm perfect and I'm not racist. Yeah, we're all racist. We are, myself included. Like the way that I took care of her was because I culturally identified with her.
Wow. I mean, it's so powerful to call it out and just say that. And I so appreciate you saying that on the stage when you gave an SGS talk. And I so much appreciate you saying that on the stage when you talk to the Green Journal board members and everybody else at the annual meetings. It's just so important. But yeah, I've never thought of it this way, that it could be a positive sequela, it could in a negative sequelae, right? Like, of course, we know it's all adaptation, right? Like we all lived as tribes and we need to find some way to survive. And now it could be either maladaptive or adaptive, just depends on where we are.
I think
right?
another good example is I was a generalist in Boston before I did fellowship. And when I was in Boston, my friends were all childbearing age. And so a lot of them would ask me to be their OB. And at first I was so honored. I'm taking care of my friends. And at some point I had to stop taking care of my friends because it would be time to do a C-section, right? Like it is time. If this was not somebody that I knew, I would have already made the right medical objective decision and called it. And I'm like, well, I don't want to cut my friend, right? Which is not good. Like that is not good medical care because the right thing in that situation was for her safety and for her baby's safety would have been a C-section. Like I was too emotionally caught where I was not making good medical decisions because, right, like the relationship had crossed a personal line that the physician-patient relationship should not cross. So I mean, and I hope that in sharing those kinds of examples that people can see easily, it translates to harm, right? It totally goes both ways.
It's so relatable and so clear. I so much appreciate it. Yeah, I mean, to take it as a segue, right, and talk about inequity in the publishing world, right? Like I myself really got interested in peer review. That was my niche in academia for a while. I really enjoyed being on the board of Green Journal, and now I'm an associate editor in a simulation journal. So my academic life, aside from being a mixed surgeon, my academic life is simulation and it's also academics and publishing and peer review. So for me, like I said earlier, there were so many instances where I was reading an article. And of course, my job was to look at the science and methodology and the writing style and make sure everything's clear and the readers get the point across and all of that, to put things into context. But to put things into context, it also means to think about equity, diversity, and inclusion, because that becomes just like an essential part of our functioning, right? So there were so many times where I was caught up with a peer review thinking like, I just don't have the terminology. I don't have the quantifiable, easy ways, as you gave like those perfect examples. I just didn't have those tools in my hands to explain people what I was seeing because I saw bias. I saw all of those isms in literature that I was reviewing, but I just couldn't verbalize it. So if you could speak a little bit about the rubric that Green came up with and the collaborative that you've organized, and what are those components, maybe briefly, for people to get a sense of what we see as peer reviewers when we look at articles.
So when I accepted the position at the Green Journal, it was a little bit terrifying because I very much wanted to do a good job. I didn't know what a good job looked like. There was no job description. Nobody had had the job before. They were starting to be associate editors for equity at journals, but it was still pretty new at the time. And so I just did a Google search of equity editors at academic journals and just cold called people and met some amazing people who become colleagues just to try to figure out what was I supposed to do in this job. And so when I got into the editorial process and handling these papers, I started to feel conflicted because I would get reviews back and the reviews just seemed unfair in one of two ways. Like some of the reviews would have the flavor, this is so important. This is critically important. It's understudied. You must publish it. And there was no critique.
That was probably me. That was probably some endometriosis article, which needed to be published, or something about fibroids. We need more gynecologist literature. It's urgent. We have to publish it tomorrow.
Yes. The peer reviewers were quite excited. Yes. And then there were other reviews that were the polar opposite, that subjected the papers to a level of critique that was so much more severe than any other paper would be would ever be subjected to. And so as an editor, you're relying on the peer reviewers to kind of point you in the right direction. I'm not an expert on everything. So in some ways, I'm relying on the expertise of the peer reviewers, and I wasn't getting good quality reviews, which meant that these papers were not getting a good shot. And I really wanted to contribute to the literature, kind of what I was saying about my mom. Like, we are far beyond problem definition. I am sick of publishing problem definition papers. What are you going to do about it? Like, that's where we are in this literature at this point. And I felt like I wasn't getting that. So around the same time that I'm kind of wrestling with, like, how do I handle these papers in a fair manner, the CTSA at my institution had a internal grant review, and they asked me to review it, and they asked me to do equity reviews. And I was like, oh, maybe they figured it out. Like, they're asking me to do an equity review, so maybe they figured out how to do this, peer review process well. So I was busy. I didn't have time. Literally, the only reason I said yes is because I was nosy and I wanted to see what they did for an equity review. And I thought maybe I could take that back to the Green Journal. So I am excited to open up the first grant and open up the little sheet that you use to do the review. And I open it, and literally it was the PI's name, the name of the grant number, and my name, and a blank piece of paper. And I was like, see, they don't know what to do either. Like, they know it's important. So like, they need an equity review, but there were no parameters. There were no guidelines. And so what did I do? Same thing I did for the Green Journal. I was winging it. Like, there was nothing that guided me in terms of a systematic way to think through things. So when we did the Green Journal special issue devoted to issues of racism and reproductive health, we assembled a steering committee. And I feel like a lot of the things I have done, I feel like I choose the hardest way to do things, but it's educational. So we assembled 29 people from across the country, transdisciplinary. So only 50% of the people on the steering committee were OBGYNs. We had attorneys, anthropologists, sociologists, nurses, doulas. I mean, there was a wide cross-section of people who I learned so much from. And so I
love it.
brought
This is like my favorite slide in my simulation talk. I'm like, the reason why simulation is not making progress is because we're siloed. I would literally say that if we could only bring anthropologists, organizational psychologists, attorneys, like all of these people together, if we could just break the silos and not think of like really near concrete terms in our immediate environment, we can just do so much better anyway. Sorry, go ahead. That was just like one light bulb that went off in my mind. So you saying like, oh, I did all this prep work and it took a lot. I was like, I'm just so blown away by that. I'm so impressed because I think that's what we're missing in our silos, and people feel burned out and are like, oh, I hit the ceiling. I'm just going to go like do some yoga now. I'm like, well, no, the yoga is not going to help you. Like, we just need to find some ways to make more progress, and breaking silos maybe is another way to do it. So it feels like a lateral move, but it's actually like a pretty impressive long-term investment. So I just wanted to highlight that because I just love that so much.
The thing is, I learned so much from the steering committee. And even though I think it was a more complicated process because we had the steering committee, it was so much better. And they held me accountable in a way that I would have not been held accountable otherwise. And so, I brought this question to the steering committee, like, how, if we're going to do this entire issue, how do we treat these papers well? So we needed a greater depth of peer reviewers. So we were using the same peer reviewers over and over again to review these papers. And so part of it was being very intentional about casting a wider net of peer reviewers.
Maybe just to kind of bring people in for those who are not often reviewing papers, which, by the way, if you're publishing papers, for every paper that you submit for publication, you should do 3 peer reviews in return because that's what it takes. So 3-for-1 rule. Anyway, as an associate editor or any editor, you actually are responsible for finding people to review the paper, right? So you basically have either a Rolodex or database or something, software of some sort, where you click on people and send those papers to, right? So whether it's mental or electronic or a combination of thereof. So one of the things that we talk a lot about is diversifying our peer reviewer pool, because if we keep asking the same people to do a thing over and over again, then that's how we get pigeonholed again and like just seeing it in one way and not having diverse input from different people. So I think that's also kind of important to highlight, is that this is how those systems become oppressive. Like, this is how we become pigeonholed and kind of doing one thing over and over again. Is this we're just not able to diversify even our peer reviewer pool because people are not able to engage or we're not reaching them, right? So that's basically, I just wanted to highlight for every editor in the journal, getting peer reviewers and recruiting them is like a number one problem at every single step of the way. So anyway, sorry, go ahead.
No, well, the thing is, when we started having these conversations, I made a concerted effort. I'm not quite as good now, but every time I would send the paper out for review, I would try to choose at least one person who wasn't already a peer reviewer. I think at this point, everybody I knew to add, I've added, so it doesn't quite work anymore, but I was actively attempting to, invite more people to the table to do peer review. So, that was part of it, is just having a larger pool. The other part of it, though, was I was still going to have the same problem where the quality of the reviews I was going to get were not great because nobody had thought about it. So we formed a subcommittee of the steering committee who came together, and this was very quick. I mean, I think that we started having these conversations in October, and the papers were due February 1st. So from October through December, we met on a regular basis, scoured the literature. We had, people with amazing expertise who were on this subcommittee and put together an equity rubric. And it was meant to be a tool that you could use to systematically go through a paper and ask questions, that really centered health equity and also action, right? Like not just problem definition. So that was the purpose of it. And we realized the more we worked on it, it didn't just apply to peer review. It's actually an amazing tool if you are conceptualizing a study, if you are executing a study, if you are trying to figure out your data analysis plan. It's actually a nice tool that can be used at any step of the journey. And one of the things we were conscious of is we didn't want it to be a checkbox. So, I think Monica McLemore, coined this term of kind of equity tourism. Like there's people who like scoop in because there's money there. And I'm sure all those people are probably gone right now. But we wanted to make sure that people just didn't feel like they had to be like, okay, I have I've done this definition of race in terms of justifying why I used it, or I have centered the margins, check, check, check. Like that's not what it is. You don't actually have to check every box. It's meant to be a thought exercise. And it's funny because I had a postdoc at the time and we were writing a paper together and she did not want to use the rubric. I made her use the rubric and she was so resistant. And when we finished writing the paper, she was like, okay, I'll give it to you. It's a much more thoughtful paper because we went through that process. So it was led by a gyn-onc fellow who was at MD Anderson, who's now finished her training. The senior author was Edwin Lindo, who is an attorney who's at the University of Washington. And it was a powerful process. And we finished it around January 1st and then have a month to disseminate it so that the authors and the peer reviewers know it. So we ended up writing a paper that was in the special issue that explains our thinking for the rubric. And then we also did a really kind of quick and dirty 15-minute YouTube video to introduce it so people can quickly digest the purpose of it. But in a nutshell,
this rubric as well as the video can be found on the Green Journal's website in the author's instruction for authors section. Right. So I've actually referred quite a few mentees for the same reasons that you've mentioned, or colleagues even, to say it's not just to review a paper, it's just also to think about your study or think about potential future projects, and also send it to other editors who are also like, we don't have an equity rubric. Do you know of anybody who has? And I do. So I think it's a really great resource and it's available online. Anyone can see it. There's a video that explains it if you want to know more in depth about it. So sorry, go ahead.
I was just recalling, I took a course my freshman year at Stanford called Europe and the Americas. And it was this Civ course that all freshmen had to take. And it's one of the most fascinating courses I've ever taken in my life because it took a period of time that I had studied before in high school that I kind of knew about. And it was, I learned about it from the European perspective. And instead, they just take the focal point to the Caribbean. And so they take that same era of history that I knew a little something about, and the Caribbean as the vantage point that we're looking. And it was amazing. Things that I never knew before. If you're centered in the Caribbean, you're seeing the same events that they talked about in Europe from a very different vantage point. And it was the first time that I remember thinking you can take the same story, shift it just a little bit from someone else's perspective, and it reads as a very different story. And I think that in some ways is what the equity rubric forces us to do. Without even realizing it, even with my personal identity as a Black woman, I have grown up in a society where my vantage point is not the dominant one, right? So I also look at the world through a worldview that does not always center my own personal identity. And so part of what the equity rubric is trying to get people to do is to get out of themselves and think about, how does you showing up change the way that you approach this work? Who are you centering in this work? If you're using a comparison group that is Black versus white, why is that? I am a Black woman. If you look at whatever my risk factors may be, and the ones that are modifiable and the ones that are going to change, I will never be white, right? So why is that my control group? And there might be a reasonable reason for that, but at least think about it. Be thoughtful in your approach. The bibliography. So I think about, and I was guilty of this too. So, we talked about kind of a lot of principles in the equity rubric. And when you're talking about these things, they often come from scholars who are from that historically marginalized group. Are we citing them? The answer more often than not is no. So take a critical look at the bibliography and see, are those voices represented? I think a really good example is I reviewed a paper for a journal that was looking at reproductive justice, which was a term coined by Black women in the early 1990s. And there's a rich literature around it. And they were using reproductive justice, but to talk about a different group of people, not Black women. And I thought the paper was like really beautifully done, but it never cited the foundational work of the Black women who had originally coined the term. They were essentially erased. So I think that is another thing that the rubric makes you do. Like, are you citing scholars who did the foundational work, or are you contributing to their erasure? Because what is the currency of academia? It's citations. Like, how many people have cited your work? And oftentimes, those core scholars who coined the terms are not the ones who are being recognized for it. So, I still use the rubric myself as I'm conceptualizing, as I'm thinking, because it is a way to hold myself accountable, to not take the easy way out and do things the way that I was trained, where you just always control for race, because that's what you do, like, right, race, marriage, economic status, education, right? Like, let's be a little bit more thoughtful in the way that we are designing and analyzing our work.
Yeah, I mean, those are really striking examples. Positionality, community engagement. When you conceptualize your study, was the community engaged? Did you get input from them? Or are you just imposing your view of things? Going back to the examples you've given earlier, are you citing people who are responsible for the core, ideas that you're actually exploring? So those are just really concrete examples that are so easy to implement in either studies or peer review or publishing or any aspects of it, right? That it just should just become a second nature, right? Like in anything that we're doing right now. So I was just blown away when I saw that, and so many people use it. I don't know if you're getting feedback from other people, but at least on my end, I'm hearing that it's incredibly useful. So I don't know if other people have adopted it or if you're hearing from other journals that are carrying this on.
I really just wanted to use somebody else's, and we couldn't find one. So we created one. And the thing is, I think it would be a good, life is crazy, but our intention at the time was to go back and revisit it, and I don't actually necessarily have access to all of the data that I would need to rigorously answer this question. But how does application for papers that do use the equity rubric, how does that change what is coming in, how that paper is reviewed, how it ends up being cited, those types of things. So I don't know. Life is crazy. Like, I don't have bandwidth right now, but maybe one day we'll get to come back to it.
Maybe somebody who's listening is going to want to conduct
Go for it.
a publishing, a peer review study and call you up to be a mentor. That would be awesome. I know our time is limited, but I wanted to reroute a little bit about next steps and what you're doing at the Green, about the mentorship program that you have going on to enhance peer review, kind of like your next step past the rubric right now, past the special edition, and we can talk a little bit more about the future.
Yeah. So one of the things with the Green Journal, I feel like every year that I have been at the Green Journal has had a different theme. So the first year was listening and learning, because I didn't know what I was doing, right? So it was educational. It was really cool because I interviewed lots of people to be on the steering committee, which was just in and of itself took an inordinate amount of time, and it was worth every minute of it. So that was the first year, was learning. The second year was really about launching the special issue and all of the things. There were so many moving parts in terms of getting funding. It was very important that the special issue be open access so that anybody would be able to access the information that was in it. So getting sponsorship for that. So that was the second
I
year.
have so many questions there, but I mean, for those who don't know, open access means that the authors themselves have to pay their way to make the article readable online without paywall for the journal or paywall for the library that is part of your institution, or a paywall of some sort. So it's a huge access issue. So wanted to spin that a little bit. So
and we wanted to make sure that burden was not on the authors, and so we sought sponsorship. All right. So
which it usually is. Mm-hmm.
Yeah. So, like that the second year was really just the special issue, and that was a huge lift. And as that time was coming to a close, I actually mourned the fact that I wasn't going to have an excuse to work with the steering committee on a regular basis anymore. But I asked them for guidance and direction in terms of what was going to be the most impactful next step. And this approach, I would encourage anyone who is committed to this work to think about. The problem is so big. Like, if you just think about like all of the things that are wrong, you can get overwhelmed and just paralyzed and do nothing because it seems like nothing that you do is going to be sufficient. That's kind of how I felt about this job when I took it. And so instead of trying to take on the entire world, each year I have just focused on one thing, right? And doing that one thing well, like within my power, in my little corner of the world, in my sphere of influence, this is going to be the thing that I do that I hope is meaningful and moves the needle even just a little bit.
Sphere of knowledge versus sphere of influence, right? As my therapist will tell me. It's funny because a bunch of parents in my daughter's school actually formed a community equity conversation group where we put on events for kids that teach them about equity. And it's like all outside of school, whether it's cultural events or we have speakers or games for them, something that helps them understand the world they live in. Because, like if you see your kid going through educational system, like my partner is Black, so our daughter is mixed race, and like I'm going to see her genderized and the race plays into it, right? So like I'm thinking, how can I protect her or equip her? Like, what can we do? Well, guess what? Parents bonded up and they felt the same way I did. And now we have this group going outside of school that is teaching our kids like those things and giving them tools. So anyway, I'm sorry to interrupt you, but it's sort of like, I think this comes up often, especially for healthcare providers, because we all had medical trauma from not being able to provide our patients with care that they deserve. So there is the PTSD component of it going on in healthcare as well that contributes to burnout. But it's like the idea of sphere of knowledge versus sphere of influence. The world is out there. This is what we can control. Like, what is it? What are the actionable steps that we can implement? And so I think there's just like a beautiful example of what that actually entails and how to conceptualize and translate those feelings and thoughts into like concrete actions. Mm-hmm. So I'm sorry, keep going.
Oh, no, it's okay. So, the charge that the steering committee gave me was kind of like their, I think, parting gift as we were kind of closing out after the special issue was published, was to train our replacements. If you look at the people who are in academic publishing, who are in these very powerful positions where they decide what is published and what is not, there is not a cross-section representative of all of the voices in our field sitting at these tables. And in some ways, it's opportunity. So when I went to the Green Journal, oh my gosh, like I had no clue. Like it was almost like the Wizard of Oz where like the curtain was lifted, my eyes were opened, and I was like, this is how this works? And you better believe I am much more competitive when I'm putting in papers and things like that now because I understand how the game is played in a way that I never knew before I had a seat at that table. And so how do we give that exposure to other people?
And I have to say that I'm like so grateful to Green Journal for the opportunity to serve because it like literally changed my mind. That Wizard of Oz view from behind the scene, like, don't take me wrong, was a ton of work. And it's a little like crazy to say how much work it was, but it was also such an incredible honor and opportunity. It was like completely life-changing. So I just wanted to thank everybody, Jason Wright and everybody else who is on the Green making these awesome changes. So Wizard of Oz, behind the scenes, and how do we get other people to sit at the table, right?
The Green Journal, with the help of Stephanie Casway, who is our managing editor, and Jen Walsh at ACOG, helped us to figure out the funding to be able to fund the Alicia Anarca and Betsy editorial mentorship program. So we are finishing up with our inaugural class. We have one more session left, but we essentially flew them to ACOG headquarters in DC, and we did training with them and kind of an overview of the peer review process, but not just from the perspective of other people's papers, because peer review has all kinds of controversy around it right now, and that is not lost on me. But I still submit to you that the best way to improve your own writing is to review the writing of others. Like you start to see patterns like, oh, like, why did they do it that way? Or why is that there? I'm much better at writing manuscripts now than I was, 3.5 years ago when I first started at the Green Journal. So anyway, we selected 5 editorial fellows who came. We trained them for a day, and then we have continued to have sessions with guest speakers and then jointly peer-reviewed papers together. And they also have come to our editorial meeting. So we meet once a week where we review all of the papers. It's a fascinating meeting. So they have been able to sit in on those meetings and experience it. And so I'm really happy and proud that we just selected last month our second class, and that class is doubled in size from the first. And so we will be meeting with them at the ACOG annual meeting in Minneapolis in 2 months for their debut. And then, the first class were kind of our guinea pigs. They told us what they liked, what they didn't like. Overall, they said it's been an amazing experience. And so we're going to take those lessons learned and apply it to the next year. So my area of focus right now is on training our replacements, making sure that people have opportunities to be at the table, especially those who usually aren't invited to the table. Like there are people who are at the Harvards and the Stanfords and the Dukes and the UNCs, right? That they would have been fine with us or without us, right? Like they were going to get what they needed, because if you're in that place where your mentor's like, hey, you want to do peer review this paper with? Like that's how I learned. Nobody ever taught me how to peer review. I had mentors who were like, hey, do this with me. And I kind of like learned on the job. But there are people who would be wonderful in the editorial world who never get the opportunity. And so part of what we're doing is making sure that people who are coming from community programs who, like some of our best editorial board members are not the people who are the big academics, right? Like everybody has something to contribute to this process. And so really trying to make sure that we provide opportunities for exposure for the next generation.
Yeah, no, that's amazing. I had the privilege of reviewing applications for this cycle, and I was just blown away by the statements and the letters and this resumes and the work that applicants have done. And it really was just amazing. It was such a diverse pool. So I'm really excited for what the future holds. What does the future hold for you? What are your thoughts? If you had a magic wand, where would you take it?
It's interesting. I actually have no idea. What drives me is impact. It is the possibility to have impact and to drive positive change that improves outcomes for people. And so, wherever that takes me next, we will see. I'm a community engaged researcher, and I spent the last decade of my life very much devoted to the people of St. Louis and the people of Missouri. And my mom grew up in East St. Louis, and, her family is from there. I didn't grow up there, but I always had a connection to that place, kind of going back and visiting as a child, and still very much care about the people of St. Louis and still work with all of my friends in the Elevate Collaborative doing that work. But what do you do when you're a community engaged researcher and you move to a community that you don't know? And I went to medical school at Duke, so I do know the Research Triangle area somewhat, but it's different. Like to be a good community engaged researcher, it takes time. And that is almost a leap of faith because, I want to just start doing stuff because I'm a type A personality and that's how I roll. And that's not how these relationships work. If you do these relationships poorly, you actually cause more harm. I'm also at a very different stage of my life now than I was when I started doing this work in St. Louis, when I was early career faculty and I had all the time in the world. And, now I am a division director and administrative responsibility. So this chapter is going to look very different than my last chapter. And resting in that and being okay in it and being okay with not knowing exactly what the future holds, but also knowing, and I'm a person of faith, that God has me here in this place for a reason. And I need to be patient and wait and see what that is. And it is starting to appear, but I'm being patient and faithful and trying to support those who are around me in the interim.
Yeah, I mean, career transitions are so interesting. It's always thinking, okay, this is what I've accomplished. What is my plan and how do I feel about what I've done and what's ahead of me? So it's interesting for mid-career people like us to think about what's next. It's harder to answer it, I think, as you get further along in a way.
and not being stressed out about it. Because, and I'm not going to lie, there have been times when I've been a little bit stressed out about it, but I almost feel like the pathway that we take in medicine is crippling, because from the time that you go to medical school, your entire trajectory, right, is essentially dictated by a computer. And this move to North Carolina is the first time, essentially since I went to college, that a computer didn't tell me what to do next. I'm like, oh, I made a decision to uproot my life that I liked very, very much and go to another place. And the place that I have come is amazing. And my partners I couldn't have asked for better partners, but there's something uncomfortable about uprooting your life and your partner and your children's lives. But in that discomfort is growth. I actually think sometimes you have to be a little bit uncomfortable to grow. And that's the season that I'm in. And I am trying to embrace it and learn from it. And I have no doubt I'll figure out what the next place of impact is for me.
Yeah, well, sitting in discomfort in midlife is where we are right now. What do you think Green Journal has in the pipeline in the diversity equity arena?
So, I think, like I told you, the issue is so great that I have taken bite-sized pieces out of this. So my focus right now is really on our training programs and making sure that I'm not going to have this job for forever. And so I think about, when I leave, what will the lasting legacy be? And Starsky Wilson has a quote that I often use in my talks that I love, that talks about, programs are wonderful, right? Like, programs, interventions, they can be great, but programs tend to die with you. It is policies that actually are what endure. And so I think, in terms of the Green Journal, what I hope will be the legacy when I am long gone and other people, maybe some of the people we're training right now, come into these positions, is that we have put policies and procedures in place that make sure that we are centering community voice, that we are centering people who have been historically marginalized, and honoring them and not speaking about them in disparaging ways that really reflect more of the society that we live in than any reflection of them. That we have done a roadmap for how to do special issues well. And so, I'm not saying that another special issue, maybe with a slightly different focus, wouldn't be in the future. And that within the Green Journal, within ACOG, there is a firm, deep and abiding commitment to continue to do this work, to make sure that the people who are doing our peer reviews, the people who are on our editorial board, the people who are on our editorial leadership team, are reflective of the full spectrum of experiences and disciplines of our field and beyond, right? Like, anyone can contribute to improving reproductive health in this country. God knows we need it.
Just looking at the photos of who is on the editorial board now and who is in leadership positions right now, is on the Green Journal or any other journal, really just looks so different than it did 10 years ago. So it's a huge attestation to where things are moving right now. What advice would you have for people getting started, or somebody who's interested in moving the needle, wants to get involved, either young or mid-career or later in their life? And when they come to you and they say, hey, what can I do, or what could I be doing, what would you tell them?
My grandmother used to always, she said that she used to work she went to Wilberforce, which is a historically Black college in Ohio. And she worked for the president, and he wrote in her yearbook, "To thine own self be true." And so she used to always say that to me as a kid. And that is the advice that I would give. I speak to pre-meds who are like, do I need to major in bio? Or do I need to do this research? Or they're trying to do the next thing that's going to give them that little competitive edge for medical school. And I'm like, and that is so boring, because that's what everybody does. Forget that, right? Like, forget checking all of the boxes of what you have to do. And you could say, easy for me to say, because I'm already a doctor and they're trying to get there, right? I get that. But if you do the things that you're passionate about, that you feel called to do, that you have unique abilities and gifts that bring something different to it. I think about my middle daughter, who is spunky and smart, and she gets in trouble because she says the stuff that's in your head that should stay in your head, but it just comes rolling out. And her vantage point on the world is so insightful. Like, I love to hear what's going to come out of her mouth, even though it's probably going to get her in trouble. And I think about that old adage, like, well-behaved women rarely make history. My child is going to make history. And as I raise her, I'm trying very hard to keep her socially acceptable, but not take out that fire and spunk that she's going to bring to make the world a better place. And so in the same way, what is that fire and that spunk that you bring to things, and tap into that? And a personal example I will give is that the work that I do with Elevate in St. Louis, in my early career days, I was spending a lot of time in the community. I was going to meetings and meeting people and spending time and building relationships. And my mentors rightfully said, Ebony, you are on the tenure track. The currency, papers, grants. You're doing too much. You need to focus there. And there was something in my heart that felt like the work that we were doing was important. Like, I didn't know what it was going to do. Like, it wasn't even called Elevate then. It was just right. Like, it just felt like the right thing. And it was another 5 years, but that work ended up becoming my first RO1. And I think because I was committed to it, like in my heart, it felt like I was doing the right thing, that I was where I needed to be. Whether it ever led to a research thing or not was not really the point. It was good work. So my advice to people is to get off of this rat race where it's like you're just checking boxes to do what you're supposed to do so you can get what you want next, and really tap into, I was going to say your calling. It sounds kind of cliche, but where are your gifts best going to be used to make the world a better place? And that's where you should be standing, not on what you thought everybody else wanted you to do. And I would argue that you're going to be infinitely better, that you're going to do better when that is your guiding light, when that is your North Star, than the North Star of like getting the next educational accolade.
That's so interesting. One of my mentors early on in the career also gave me this advice, but like, I looked at everything you're doing. Why are you doing all these things? Like, it's too many things. You have to focus. If your goal is X, Y, and Z, drop all that other stuff. But I felt exactly the same way as you. I was like, well, it's a program that's really important to the residents, or this is a program that's really important for this clinic. Like, yes, it's time consuming, it drains energy, and it takes a lot out of me, but like, I couldn't really put it into words, but it was like, I don't think I can give all these things up. Like, yes, maybe it'll slow me down, or maybe it'll reroute me, on my career path, and maybe I'll get to whatever point I want to get to, never or later, I don't know. But it just felt weird to like kind of drop things that I felt like so strongly attached to or thought were making a difference. But I think in the same way, we just probably don't realize what impact we're making until later, right? Like, I had one of the medical students tell me that like after a simulation intensive, it was like a 4th-year elective, and she wasn't even going to OB. It was like an emergency room match, ER match. She's like, whatever it is that I learned in whole of med school did not really amount to what I learned in this elective, because I learned how to learn, and I learned how to grow, and I learned how to get like my growth mindset integrated into my future professional life. And that I'm going to forget like all these OB things you just taught me, but I'm going to take that learning style with me into my professional career. So I think like when you hear from people things like that, right? Like maybe it was community engagement, or maybe it was like, that's the wrong word. Like, it's not community service. It is community engagement. Like, it's just us not serving, it's us engaging with things that we care about, right? It's so interesting. Like, yeah, maybe it didn't lead to a publication, all that specific project did, but it pays off in other ways, right? So I think it's just kind of that was not the advice I was expecting from you. Somebody who accomplished like so many things within such a short period of time. But I guess it's just like really important for us to keep perspective in mind. So that's great. Well, I think we're out of time, and I could keep talking forever. I really enjoy spending time with you, and thank you so much for being here to share your story and your wisdom and your advice and your insight and perspectives. It was just so wonderful to have you here.
Thank you so much for having me.
Thank you, Mark Hoffman and Amy Park, for allowing me to host this wonderful guest, and really looking forward to future episodes. And thank you for being a part of it.
Thank you so much for listening. If you haven't already, make sure to follow the podcast, rate it 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable OBGYN on Instagram, Twitter, or LinkedIn. BackTable OBGYN is hosted by myself, Mark Hoffman,
and Amy Park.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Josh McWhirter,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz, with support from
Taylor Spurgeon Hess and Yvonne Overjinsky.
Show notes and social media by Emma Landenwich
and Lindsay Beecham.
Administrative support provided by Judy Dela Cruz.
Music written and performed by Scott Baby Daddy Hoffman.
Thanks for listening, and we'll see you again next time. The views and opinions expressed by the hosts and guests on BackTable OBGYN are their own and do not